Do you ever get confused when you're trying to find a therapist, but you've also heard them called licensed professional counselor or licensed marriage and family therapist, but you also know the word psychologist and you also know the word psychiatrist, and you're just confused because you're like, what do all of these mean and how do I just get therapy? Then this is the video for you. So this is a little hard to explain because it is going to vary state by state. So for example, I'm in the state of Texas, so this is really just going to apply to Texas and maybe a few other states that are similar to it. But if you're seeking therapy in Texas, the majority of the time you're getting therapy from a licensed professional counselor, a licensed marriage and family therapist, or a licensed clinical social worker. All of these three licensures are going to usually have a master's degree, and then they also go through the licensing process, which is usually like a number of supervised hours, like something crazy like 3,000 hours usually. And then after that, after they are fully licensed, they get to work on their own. They don't have to have a supervisor anymore. Where things get confusing is we also hear the word psychologist, and at least in Texas, a psychologist is usually going to be someone with a doctorate degree, and they're going to be trained to do like psychological testing, not like just give a diagnosis, because like a therapist can give a diagnosis, but do formal testing to get like for sure answers from all these databases and all this other crazy stuff. And then psychiatrists are going to be like med management. So if you're wanting to get like on meds, you'd be looking for a psychiatrist. A psychiatrist in the beginning may talk to you like a little bit more in depth. But beyond that, usually sessions after that are going to be a little bit more about like, how are you doing? How are your symptoms progressing? Are you making progress on this medication? And they're really just checking the boxes. Whereas a therapist is going to help you come up with like coping skills and get to the root of the behavior, because symptoms can persist while you're on medication because there's other things going on outside of just your chemistry. Maybe the way you cope with things, the way that you react to things, or even some trauma that you don't realize is affecting you this way. So in the end, yeah, that's kind of the breakdown of what you're looking at when you're going into the mental health field, looking for treatment in Texas. And then as my other little tidbit of information is that if you're on med management and you're not seeing progress, I always recommend therapy because it will really help you get to the root of your issue, whereas med management is just going to help the symptoms.